Good night. I'm EMT Spencer, along with me is my partner, Steve, and EMT Small. Pay the patient, it's a golden. Receive a call that a patient, two man was in a fight. Man used a knife to stab patient, and patient collapsed to the ground. So, BSI, scene safety. Number patient 1, mechanism of injury, stab to the chest. I would consider C-spine, and also consider additional L. So, approaching the patient line of sight, creating my general impression. Patient, 29-year-old male, African descent. See obvious blood to chest. Alright, so approaching the patient the line of sight. Sir? Can you hear me?
Yeah.
Good night. Patient response. So patient have a patent area. So at this time, I don't want to ask my partner to maintain manual stabilization. And I would also want to expose patient chest and put on an occlusive dressing. So I would get the scissors and expose the patient chest. Due to the patient have obvious bleeding, I want to control it. So I would put on an occlusive dressing. I would tape the 3 side and leave the side over to the chest area. Alright, so the wound is secure. So I would want to check for breathing. So I would look, listen and feel patient equal rise and fall in chest, depth. Alright, so at this time I would want to auscultate the chest. Deep breath. Auscultate. At this time I would want to put on my pulse oximeter. Turn the pulse ox. Reading 90. So at this time I would want to give patient oxygen. So I would put on the mask, give 50 liters of non-rebreather. Oxygen therapy coming. I would move down to circulation. I would want to check pulse, pulse strong, bounding. Want to check skin condition, skin. Want dry, check the eye. Pink. I want to check capillary refill, breast. So at this time I would want to initiate transport decision. For this patient, I would want to load and go. So I would then move to a rapid scan of my patient. So at this, I would want to do a decap details, check for deformity, confusion, laceration, burn, swelling, tenderness. Check patient, check the ears of the patient, check for any cerebral spinal fluid, check the jawbone, thing intact. I would want to check patient neck. So at this time I'll check for trachea deviation and jugular vein extension. At this time I would want to put on a C collar. C collar is now affixed to patient. I will continue my rapid scan. So check clavicle, decap BTLS, check the abdomen, check the 4 quadrants, check the pelvic, push in, decap BTLS. I want to check for pulse, bilaterally. Use a pulse, bonding. I want to check. Sir, if you can hear me, please push on on. So, okay. Can you feel that?
Yeah.
Alright, so I want to check the arm. Decap BTLS. Decap BTLS. Alright, so at this time, I don't want to get the backboard, so my partner, get the backboard. Alright, we're going to log roll this patient as a unit. So, the man at the end, do the count.
Alright, and 3, 1, 2, 3.
So at this time, I would want to check patient back, and I would also auscultate. Clear low sound. Check back for any bleeding. Alright, no bleeding. So at this time, I don't want to lag roll patient to backboard, the man at the end.
Alright, and 3, 1, 2, 3.
Alright, so get him on the backboard properly, so it would go down. Count
1,
on 3.
2, 3, down.
1, 2, 3, up. Alright, at this time, patient is secure to the backboard. I would want to affix the head block so my partner could get that easy at the end. So the head block is now secure. Alright, so we strap the head and strap patient to secure. So this time with the ambulance, so we want to do a set of baseline vital signs. So we want to check the get a blood pressure reading. Blood pressure 130/80. I don't want to check the pupil. Check the eyes for pearl. Check the skin condition. Alright. At this time we complete our vital signs and we are en route to the hospital. So en route to the hospital for this patient would reassess every 5 seconds. So we reassess patient, check the wound as well, check the interventions and all of that. So at this time we en route would make a call. We have a 29-year-old male patient was in an altercation, received a stab wound to the chest. We put on an occlusive dressing, we give oxygen and monitor. Now we are handing over the patient now at the hospital. So thank you for watching. This is my long case trauma.